Hello, my name is Richard Wallace. I'm a Dairy Technical Services Veterinarian with Pfizer Animal Health. I was formerly the Dairy Extension Veterinarian at the University of Illinois. This presentation today was given at the 2012 Illinois Dairy Summit sponsored by the Illinois Milk Producers Association. Today we're going to talk about your risk for causing meat and milk residues on dairy operations. The dairy industry is now under increased drug residue surveillance, and I guess the question we need to ask is why are we seeing that happen? If you look at the top sources of beef carcass drug residues, culled dairy cows and calves sold from dairies are typically the highest residue violation sources. Dairy calves sold from dairies could be either listed as bob veal calves or special fed veal calves. And where we see the greatest number of residue violations are in those young calves that are sold at less than 21 days of age or under 150 pounds. If we take a look at a graphic here, looking at the frequency of residue violations on this vertical axis, and then over the last 6 years from 2005 to 2010, and then on this axis, we're looking at the class of animal. And so if we just take a look at the non-dairy species that are used for food production, you can see that beef cows have the highest residue violation of the non-dairy animals. When we take a look at where the culled dairy cow and the veal calf, you can see that the majority of those violations over the last 6 years are coming through from dairy species animals or dairy animals coming off of dairy farms. If you look at these are the 2009 data, and these are the slaughter violative residue comparison between beef cows and then dairy cows and then fed cattle. So fed cattle would be dairy steers and heifers. You can see there's over 27 million animals harvested and only 16 adulterations found in those 27 million. Now keep in mind that not 100% of these animals were tested. It's a random sampling approach, and then there's a target approach, which we'll talk about a little bit later. But if you take a look at the dairy animals, only 2.6 million dairy cows were harvested, but 800 of violations in those 2.6 million. So again, the risk from dairy cattle is 400 times that of fed cattle and at least 20 times that of beef cattle. So if we look at a summary of the reasons for those dairy carcass violations, we can see that this was all based out of the 2009 data set. And so it is a biased data set because it's coming from inspector-generated samples. In other words, the inspector suspected that the animal or the carcass might have a violation. But you can see the top 3 antibiotics, which account for 75% of the violations, come from penicillin, Flunixin meglumine, and sulfadimethoxine. And many of you may know Flunixin as Banamine as another term. So this is the most current data that we have is 2009, and you can see the majority of those violations are coming from those 3 classes of drugs. When we look at the rest of the violations, you can see that under 10% of the violations are coming from these other classes of antibiotics. So if we could focus on preventing these 3, we'll have a major reduction in the residue violations occurring in cattle. Interesting to note, if you look at this gentamicin listed right here, 5.6% in 2009, in the early or late 1990s and early 2000s, I was giving extension meetings on residue violations, and I pulled this slide out of one of my old presentations from a Dairy Day talk. And the number 1 violation in 1999 was gentamicin at 39%. And if you remember back to the previous slide, we're at 5.6% 10 years later. And I guess the question we need to ask ourselves is why has gentamicin dropped so dramatically? When I think about what's happened with this class of antibiotics, gentamicin or the aminoglycosides, it was in the late 90s that we actually voluntarily, as a veterinary organization, as many veterinary organizations, but as an industry, agreed not to use aminoglycosides in food-producing animals, and in particular in dairy cattle, primarily because of the extended meat withhold time or tissue residues that occur through these classes of antibiotics. And so when I look at this number, and this is what we can do voluntarily, if we know what the rules are as an industry, we can get this level down to 5.6%. And quite frankly, I think we need to do a little bit more work because that should be 0% there for gentamicin. But if you take a look, the number 2 antibiotic that was found in 1999 was penicillin. And that is now the number 1 drug now that gentamicin has moved out of that top spot. You'll also see sulfadimethoxine is still listed in there at number 3. And sulfadimethoxine, when you look at the name brand of that would be Albon. And it is approved for use in dairy cattle, but there are only, we'll talk about that a little bit later here, there are only approved uses that can be used. Otherwise, everything else is prohibited. So when we look at these other two, we need to sort of make some decisions on why this might be happening. So I guess the first question is what is it about penicillin? Why is penicillin such the number one in 2009, and why was it number 2 in 1999? And I guess the question we need to ask ourselves is why do we use penicillin on farms? And most producers will tell me is because it's cheap. It's a very inexpensive antibiotic. I guess I ask the question, though, is what are the label indications? This is what I usually ask a producer. What are you allowed to use penicillin based on the label that's on the bottle? And if you read the bottle, it says we can use it in cattle and sheep for bacterial pneumonia, or what we might call shipping fever, that's caused by Pasteurella maltosida. Now, I could probably go out to about any dairy farm in the United States and take some swabs out of the nasal passages of some calves, and I could probably find Pasteurella maltosida. It's a very common pathogen that just sort of lives in the upper respiratory tract, and it really doesn't cause disease or pneumonia until viruses or other actions actually cause the respiratory immune system to be depressed, and then it can take over and cause disease. So it's very common to find Pasteurella, so I can see why it's very easy to use penicillin on label for pneumonia. But we see penicillin used on dairy farms for many diseases, lameness conditions, post-surgical, just about any bacterial infection, metritis. You'll see penicillin used quite oftenly. Now, when I think about it, what is the dose of penicillin? When we think about, what's the label dose? And the label dose is 1 cc per 100 pounds of body weight in the muscle once a day for 3 to 4 days for a maximum of 4 days. Now, when I was in veterinary school, and this is back in the late 70s and early 80s, they told us that the dose of penicillin, you need to give 3 to 5 cc's per 100 pounds of body weight to be effective against anything. And so even back then, we're talking 25, 30 years ago now, penicillin was not used according to label. The label has not changed since that time. And when we think about it, we're probably overdosing these animals. The other overdosing to get effectiveness, but also overdosing them, and we need to think about what that might do to create residues then. The other part that says on the label is no more than 10 cc's or 10 mLs per injection site. Now, the Beef Quality Assurance program says that one injection site is 1 hand width or 6 inches apart. So that would mean that if we're going to give an animal upwards of 20 to 25 or 30 cc's, that would be given in 3 different injections 6 inches away, and that's all IM. And then if you follow these two guidelines as far as the dose and the amount per injection site and the duration, the milk withdrawal after the last treatment would only be 48 hours. And that actually makes sense when you give such a low dose. But when you think about where we're seeing milk withdrawals on penicillin on farms, if you're testing your cows for penicillin, upwards of sometimes up to 2 weeks. But that's because we're probably giving more than 10 cc's per injection site, and we're also probably giving much more than 1 cc per 100 pounds of body weight. Now, when you look at the slaughter side of things, the meat withholding is 10 days if you follow these label and route and durations. But again, because we typically exceed this duration or we give it sub-Q instead of IM, you're going to see extended meat and possibly milk withholdings when you give it in alternate locations and at alternate injection volumes. Now, typically, if you look on the bottle, it says exceeding the recommended daily dose of 3,000 units per pound of body weight and administering the recommended level more than 4 consecutive days and or exceeding 10 cc's per injection site may result in antibiotic residues beyond the withdrawal time. So the companies that make this penicillin, they've got this disclaimer on here that if you don't follow the directions, you may have longer withdrawal times. So we have to keep that in mind, that just because in big bold print it says 48 hours milk, 10 days on the meat, doesn't mean that that's what our withholding time is. So I guess the question is, if you're a dairy producer, how much would you give a 1,500-pound dairy cow? Would you stop at 15 cc's? And I think most producers realize that that's not an effective dose to treat nearly any condition that you might be using. But we also have to keep in mind that we're using it for other conditions than bacterial pneumonia. then all of a sudden you're using it in an extra label fashion. And anything that you do that's not listed up here and above in these first 3 bullet points is considered extra label. And if you use a product extra label, there are certain conditions that apply. So we'll talk about that in a minute. But I think this is probably the reason why penicillin was number 1 in 2009 and still number 2 in 1999, 10 years ago. This is most of the reason. It's a very inexpensive drug and it's not used according to label. So I guess the next thing we need to sort of think about is that what is that number 2 drug that we found listed in 2009? It was Flunixin. And if you look back at the 1999 data, Flunixin wasn't even on that list. And I guess we need to ask our question, why wasn't Flunixin there? And I'll answer it for you, is that we weren't testing for it then. Flunixin was available for use in cattle in 1999, but it was not. There was no diagnostic test to pick it up in the meat or in tissues. So when we look at why cattle are now tested for antibiotics, there is the random testing program. So there are some random samples that are pulled, but there's also a targeted residue testing program. So if a black and white dairy cow comes through the slaughter plant and has any of these conditions, mastitis, metritis, peritonitis from a surgery, pneumonia, or an injection site lesion, that animal is probably going to be retained and tested for further antibiotic residues or tissue residues. And so these injection sites, they don't know if they're, the meat inspectors that are in the plants don't know if they're from a vaccine or a bruise or from actually an antibiotic injection. But if they do see it, that is a red flag that then they need to test the rest of the carcass for residues. So we need to talk about ways that we can reduce injection site lesions by using good beef quality assurance injection techniques, but also keeping cattle on the farm long enough for those injection sites to heal up, and then the carcass is ready then for human consumption. But let's take a look at some intramuscular Flunixin injection site lesions. Now, Flunixin meglumine is only labeled for intravenous use in dairy cattle. And if you use it intravenously according to the proper dose, then it's a 36-hour milk withholding and a 4-day meat withholding. But if you give this injection intramuscularly, and these are very good pictures here, you can see how the tissue has just been damaged. It's what we call necrosis is in the center of these brown spots. This is basically a burnt piece of tissue, and it's been chemically burnt by the compound that was used in the Flunixin. So when you look at the damage that's done here, you can see that this is not a healthy piece of muscle, and it's not going to be a healthy or a quality piece of beef after that. So when they see these injection site lesions in the slaughter plant, they have to trim it out, number 1, but then it also flags that carcass for further testing. I want to take a look at one other thing here. When we take a look at the different antibiotics listed here in the left column, these are different types of antibiotics you might find used in cattle. There is a maximum residue limit in cattle tissues. The FDA has said that at these levels, the tissue is safe for human consumption. And let's just focus on one antibiotic here, oxytetracycline. There's many different NEDAs, so a lot of different companies have oxytetracycline. The allowable level in the maximum residue limit that's allowed in tissues is 12 parts per million in the kidney, 2 parts per million in the muscle. The test that they run on the carcass in the slaughter plant is called the KISS test, or the kidney inhibition swab test. And it will pick up tetracycline at 0.05 parts per million at a very much lower level. But at this point in time, the kidney inhibition swab test is simply just a test that says there's an inhibitor in the kidneys. Essentially what they do is they take a little cotton swab and they stab it into the kidney a bunch of times and then they incubate it. And if there are inhibitors, antibiotics on that swab, the media will not change color and it basically triggers a positive test. At this point in time, we don't know that it was oxytetracycline. All we know is that the kidney had some kind of an inhibitor in the tissues. Then they actually will pull muscle, kidney, and probably also liver from that carcass and test it specifically to find out what was the inhibitor that was in the tissues. If the tissues were at, let's say, 15 parts per million in the kidney, then the carcass would be discarded and thrown away. If it was 5 parts per million in the muscle, again, the carcass would be disposed of. On the other hand, if it was down around 10 or 5 parts per million in the kidney or 1 or 0.5 parts per million in the muscle, the carcass would be good to go. And because the levels are low enough that we know that the safety of that food product is now safe even at that much lower level of oxytetracycline. But the point is that these swab tests, there's a lot of different false positives. All these greens would be triggered as false positives, but the rest of the carcass would get tested. So the important thing to understand is that if you even have any extra oxytetracycline in the animal, from a quality standpoint, is that really what the message that we want to send out to our consumers. So one thing we need to keep in mind that is if you get caught with shipping an animal into the slaughter plant that has a volatile residue, there are consequences. And it is all part of the public record. Here are 2 websites that everyone has access to. There's one, the same source supplier list, and then there's also the repeat violator list, as well as the FDA warning letters that are sent out once a month. And so you can actually pull this up and get a list of anybody that's had an antibiotic violation. So we need to keep in mind that all this information, if you have a residue violation, is part of the public record. This is just an example of one of those reports that you can get from that website. You have the source of the producer. You have the plant that the animal was actually slaughtered in. And then you have the type of animal. And we take a look at this. You can see this one has dairy cows. They found penicillin in the kidney, and they give a value. The value was 0.16 parts per million, and the tolerance level for penicillin is 0.05. So it exceeded the tolerance level, and you can see that that was one of the violations. Here's another one here that's veal calves. So these would be calves less than 21 days of age, and not only in the kidney, liver, and the muscle, they found a drug called tulathromycin. It was detected, and you notice there is no tolerance for tulathromycin at any level because this drug is not approved for use in veal calves, which means it was used in an extra label manner. And we'll get to that in a minute because extra label drug use requires there will be no drug residues. Here's one with a steer with Flunixin and sulfadimethoxine. And you can again see there's a value and a tolerance level for steers. But in Holstein here, you can see gentamicin. This is one of the ones that we have voluntarily agreed not to use, but it was detected again and there's no tolerance level listed. So if we take a look at the reports, then this is something that one of the reports you get from the warning letters, and you can sort of read down through the information, but I'm going to highlight actually several comments that they have in there. But if you think about pulling this information off the website and how dramatic the wording is, you hold animals under conditions that are so inadequate. Adulterated flunixin, meglumine, sulfadimethoxine, oxytetracycline. Drugs not used according to label directions, thus extra label. And extra label use must be on or order of a licensed veterinarian within the context of valid veterinarian-patient relationship. This wording is very inflammatory, and it's not wording that obviously you want to have associated with your dairy operation. Well, all these residue violations have led to an increased scrutiny for milk production. And so milk is now under the same kind of scrutiny by the FDA, and we have to keep in mind that these assignments actually began in January 2012. So the FDA is now under the assumption that we really do a great job of testing milk for the beta-lactam classes of drugs. I'll talk about those in a minute. But there are other drugs that are used on farms that we really don't have a routine drug testing program for. With that increased number of drug residue violations seen in cows and calves sold off dairy farms, this has led the FDA to be concerned that there is a lack of control on dairy farms, which could lead to these drugs actually being present in the milk, since we're only testing the milk right now for the beta-lactam classes of antibiotics. So what are those beta-lactam classes? The pasteurized milk ordinance requires us to test all tanker loads that leave dairy farms for penicillin, ampicillin, amoxicillin, ceftiofur, cefacparin, and cloxacillin. So everybody kind of knows what penicillin is. Ampicillin, a trade name for that might be Polyflex. Amoxicillin, a trade name for that would be Amoximast. The ceftiofur line of products would be like Xnl and Naxel and Exceed and Spectromast, and those would be the typical ceftiofur products. Cefacparin would be products like Today and Tomorrow, or Cefadry and Cephalac, and then cloxacillin, you might find that in Dairy Clox or Ben and DC. So you can see that all these drugs are very commonly used for mastitis or for taking care of ill dairy cattle. And so we do test all tanker loads. So all tanks are clean of that before they're ever even offloaded and used for human consumption. On the other hand, this new drug test that the FDA is going to has started to do as of January 2012 is to look at other classes of drugs that we're seeing in carcass violations that may also be shedding in the milk. So they're concerned that because we're seeing these increased number of residues in dairy carcasses, potentially there are these other drugs that are found in milk. So we need to understand how this testing is going to be applied. Currently, the FDA just wants to know what is the prevalence of increased residues that might be in the milk that we're not testing for. So they're really not interested in creating a violator list on the milk side, because right now all the milk is being tested for beta-lactams, and those violators are actually being then that milk's being dumped and those violators are being dealt with. But this is going to be a double-blinded process, so neither the milk processor nor the FDA will know the source of the milk. They'll have 900 samples coming from the repeat violators. So if you look at the repeat violators list right now, there's about 1,800 producers on the repeat violators list, and that would be a producer that had 2 violations within 1 year on a meat side of things, on the beef side. So we're going to roughly test about 50% of those producers. And then they're going to pull 900 samples from non-violators. And so that means we have roughly 63,000 dairy producers in the United States. And so you're going to be about 1.4% of the non-violators to see if there's any potential. I was down at the National Mastitis Council in Florida this past January, February, and Matt McKnight, who's with the U.S. Dairy Council, had a presentation where he mentioned that they're also going to test 300 commercial products and to see if we actually see if there's any residues coming out on the commercial side as well. And so all this is pretty scary stuff if we have some concerns that producers are not doing the right thing and holding the milk properly. So I guess the question is what are you as a producer and what are you as a veterinarian to do to get this under control and make sure that we're not creating extra residues? First, we need to understand which set of label directions to follow. There basically are 3 different kinds of drugs on a dairy farm. There's the over-the-counter product that you can buy from Farm and Fleet or any farm store without a veterinary prescription. Penicillin is a great example of an OTC product. Then there's other products that are called prescription products, and every prescription product has this label on it, caution. Federal law restricts this drug to use by or on the order of a licensed veterinarian. When we look at extra label drug use, then that is an over-the-counter or a prescription product that's not used according to label and used obviously then in an extra label or an off-label approach. So we need to keep in mind that there are appropriate uses for each of these products, and then you need to understand which of those labels to follow. So let's talk a little bit about extra label drug use, because that's when you take a product, whether it's an over-the-counter or a prescription product, and use it in a manner that's different than what's written on the label. So when OTC drugs, they are used not according to the label, that requires there is a prescription, just like you go to your doctors and get a prescription for any other medication. This is the same kind of thing with the over-the-counter product used not according to label or in an extra label fashion. And that prescription then requires that it's being done within the context of what we call a valid veterinary client-patient relationship. So let's talk a little bit about what a VCPR is, or a valid veterinary client-patient relationship. And I've highlighted, I think, the key points that are sort of the sticking points in the VCPR. And currently, the AVMA and many of the other veterinary medical organizations are trying to establish what are the definitions and the boundaries of a VCPR. So you'll see that coming out hopefully before the end of 2012. But when we think about it, the definition of the VCPR from the Animal Medicinal Drug Use Clarification Act states that there is sufficient knowledge of the animals by the veterinarian to at least initiate a preliminary diagnosis of the problems of the animals. So in other words, the veterinarian has to have seen the animals on the farm and sort of know what the problems that are going on. It means that the veterinarian has been there or personally acquainted with the keeping care of those animals, either through an examination or what we might call herd health visits or medically appropriately timely visits to the farm. Now, what is timely? Is that once a month? I guess it really kind of depends on the operation. If the operation is, a large feedlot, it may not need to have a veterinarian there once a month. But a dairy operation where it's kind of a continuous flow process probably needs at least monthly visits to make what we would call a medically appropriately timely visits to make sure that things are working in a proper manner and that conditions are being cared for. The practicing veterinarian also has to be readily available for follow-up in case there's adverse reactions or failure of treatment therapy. So when we look at the definition of the VCPR, you can see it's fairly encompassing, but it's also a little bit broad. And so there are some fine-tuning that might need to be done. And again, the AVMA and the other veterinary medical associations are trying to take care of that. But as a veterinarian, prior to prescribing or dispensing a product in an extra label manner, the first thing I need to make sure is that I will not create an illegal drug residues. So I need to make sure I take appropriate measures to get the veterinarian or get the producer to understand that you have to hold the milk an additional length of time. You have to hold the animal on the farm an additional length of time until there are no residues left. And so that's sort of the circular argument as we get around to it, because that is our caveat, or the tenet that we have to follow as veterinarians when we prescribe a product in an extra label fashion. So when you think about when a producer is taking a bottle of penicillin from, let's say, Farm and Fleet, and buying it at the farm store and using it extra label without a veterinarian's prescription, then it's the producers, and that is considered an illegal use because it has to be done again under a veterinary prescription to be used in an extra label fashion. So let's just take a look at the list of drugs right now that the FDA is prohibited for use. So if everybody understands, those first two, ECP and diethylstilbestrol, those are two estrogen products. Chloramphenicol is an antibiotic along with the nitrofurans. Clenbuterol is a sort of a beta agonist, and then you've got dipyrone, glycopeptides, gentian violet, and phenylbutazone. So phenylbutazone is a nonsteroidal anti-inflammatory, much like Flunixin, but it is now considered a prohibited drug in adult dairy cattle. So if we take a look at the drugs that are prohibited from extra label use, so now these drugs can be used in food-producing animals. There are approved uses, but they cannot be used in an extra label fashion. And here we have sulfonamides, and this would be sulfadimethoxine would be a very good case here because there are approved uses of Albon or sulfadimethoxine in adult dairy cattle. In fact, there is a meat withholding and a milk withholding. But they need to be used only according to label, which means if you're using the sulfa-Albon boluses, then you can only use them for pneumonia and foot rot. So they're very distinct uses. The fluoroquinolones, such as Baytril and, the other fluoroquinolones are not approved for use in dairy cattle, but Baytril can only be used in dairy heifers. It's not approved for pneumonia. So you cannot use it extra label. You can't go increase the dose. You can't use it for a different condition. You can't use it for scours. That would be a prohibited use because it's only approved for use in pneumonia in dairy heifers. The medicated feeds are now prohibited for use. Years ago, you used to be able to feed aureomycin or tetracycline crumbles to dry dairy cows or something like that. It is now a prohibited use to feed medicated feeds to food-producing animals. So they're only the approved uses then, which would be in dairy heifers and some of those kind of things. And then more recently here, starting April 1st of 2012, there is now a prohibition on extra label use of the third-generation cephalosporins. Now, there's a little caveat to that because you can still use them as a veterinarian can make a recommendation to use them in an extra label fashion as long as the veterinarian stays on the same route, dose, frequency, and duration of treatment. If you extend those or go in a different route or different frequency, then that would be a prohibited use of a third-generation cephalosporin. So if we think about that from those standpoints, there are some drugs that are prohibited. There are some that are prohibited from extra label use but are prohibited to be used for their labeled uses. We need to keep in mind that the FDA is actually looking for certain antibiotics. And so many of these antibiotics are found in cull dairy cows, but they are prohibited for use in female dairy cattle over 20 months of age. And most all of these are also prohibited for use in veal calves, so those young calves. So if we find them in veal calves, then they were used extra label. And if we find them in a residue in an adult dairy cow, then it was probably also used extra label. And remember, there's no tolerance for residues that are used in an extra label fashion. And so that's where the circular argument gets, is that, yeah, I could go ahead and use florfenicol in a dairy cow in an extra label fashion, but I need to make sure that that dairy cow is kept at the farm long enough so that her meat and milk have no residues by the time she goes to slaughter. And that is the circular argument we get into with the extra label use and the no tolerance. So let's take a look at that, how that might actually play out in some different, this is an April of 2009 or maybe 2010 residue violation list that we can pull off the internet. And you can see we've got the class of animal over here, bobveal, dairy cows, or some goats. And you can see the different tissues that were found. But you'll notice that in bobveal, Flunixin, and it was found at these tissue levels, parts per million, and there is 0 tolerance listed because Flunixin is not approved for use in veal calves. Here's dairy cows for gentamicin, found in the kidney, detected. They don't even report the level because if it's detected at any level, it's because there's no tolerance. It's considered a violation. Drop down here to tomicin and telathromycin, dairy cows and a veal calf. Again, both of these drugs are not approved for dairy cows or veal calves, and they are again detected, and there is a 0 tolerance. To play this out a little bit further, let's take a look at this is again from that April 10th or April 1st, 2010 residue violation system, and you can see that here's a beef cow, and there's tomicin found in the liver at these levels with a tolerance level of 1.2. It is approved for use in beef cows. Micotil is approved to treat pneumonia in beef cows. Micotil is not approved for use to treat pneumonia in dairy cows. So 2 different classes of animals, 2 different tolerance levels, and you would think that once you strip the hide off of this animal, it is basically a beef carcass now. But the way that the FSIS inspectors and the meat and packing plants have to look at this is that this is a dairy cow. If tomicin is found at any residue level, it must have been used extra label. If the drug is used in an extra label fashion, there is no residues allowed. And so we get back into that circular argument that it may not be fair to the dairy industry that there is no tolerance, but on the other hand, we are out here to produce safe and wholesome food for the consumer. So I get back to my question is why is the dairy industry under increased surveillance? And I want to use a little of an analogy here. So I'm going to show you a picture, and this is a picture, and if you read down here below, this is actually my Ford Explorer coming around Cedar Rapids, Iowa. And you'll see that the speed limit was 55 miles per hour, and I was going 67. And this is a speed camera that picked me up. And is that a fair way to get picked? Actually, what happened was I got an email from our leasing agency that said you have an unpaid traffic citation. And so I looked up the email and I said, what's going on here? And sure enough, they caught me on a camera. So when you take a look at it, I had a nice $75 fine because I was going over the speed limit, plus a $20 internet fee, plus a $20 fee, so it was like $115 to get out of this violation. Is it fair? Well, if you take a look at Wisconsin and Illinois, the legal speed limit in these 2 states is 65 miles per hour. With my new job, I actually travel over here into Iowa and Missouri and South Dakota, Nebraska, and Kansas. So when I'm driving around in Nebraska and Kansas, I can legally drive 75 miles an hour. But once I get into Iowa, I need to slow down to 70 miles an hour. And when I get into Illinois, I have to slow back down to 65 miles an hour. And I guess the question I would ask is, am I any less safe driving 75 miles an hour in Kansas or 75 miles an hour in Illinois? And it's just the way that the regulations are. And I guess if you think about this as a beef cow versus a dairy cow over here in these states, it is a different regulation in the different states, and those are the regulations that we need to follow. So when we start thinking about the reasons why we see an increased number of carcass violations and residue violations, when we see increased testing, so now we're actually flagging dairy cows more often, and the meat inspectors are more suspicious, I guess, of dairy cows coming in because over the last 6 years we've seen increased violations from dairy animals. And we have more sensitive screening tests. We've added Flunixin to the testing system. We've got tests now that pick up antibiotics or residues at much lower levels. And so when you look harder with a more sensitive test, you're likely to find more violations. That doesn't make the violations right. It just means that there's more, and we have to be more cautious on how we're taking care of business at the farm level. So this has led the FDA. They're convinced that all the beef residues are a result of one of two things: extra label drug use or over-the-counter drug use without veterinary supervision. So if we take a look at that same list of antibiotics that we found from the FSIS Residue Violation Information System for 2009, remember penicillin was number 1, Flunixin 2, and sulfadimethoxine was number 3. I've starred the ones that are actually over-the-counter products that you can get over the counter. And you can see there's a good number of them, and particularly 2 of the top 3 are OTC products. And again, the FDA is concerned that these residues are coming from antibiotics that are being used over the counter and used without veterinary supervision. And they've actually made hints that all products are going to go prescription only. So I guess the question is what do we need to do as a producer? And I think if we have adequate treatment records that help us identify which animals have been treated and which animals we need to hold for an additional period of time, that's going to help us at the farm level make sure that no mistakes happen and no animals get shipped in before they're due to be going to slaughter. So first off, we need to have unique identification of all animals on the dairy. So just having cow names and being able to pick cows out by their color and by their spots is not going to be adequate anymore. We need to have some kind of hard ID on the animal through an ear tag or a clip, or even what we see now is RFID, radio frequency IDs. We need to maintain those treatment records for a minimum of 2 years. Some states, like the state of Wisconsin, require that you maintain them for 5 years. Think about your tax records. Most of the time we maintain those for up to 7 years. And then the treatment record needs to contain the following information. Have to have the ID of the animal treated, the date she was treated, the product that was given, the dose, the route and location of administration, and then also on that list has to have the earliest date the animal could be shipped, either for slaughter or if it was a milk producing animal, we need to make sure that those milk withholding times are established as well. And then I like to actually also have the name or initials of the person that administered the product. And coming from a history of managing a dairy operation, I understand from a compliance standpoint it's helpful to have that information, but quite frankly, the FDA does not require this. We have the name of the information, but it does certainly help from a management standpoint. So then once we have good treatment records, we need to develop a proactive residue prevention plan. And so we need to develop a written set of treatment protocols that need to be based on sound science behind those treatment protocols. So for every condition that you might actually pull a medicinal out of a cabinet and use on an animal to cure that animal, we need to have a nice written set of protocols that the FDA or anybody could come in and look at that would say, okay, this is how we treat an animal and how we withhold the milk. Incorporating effective products that have dairy-friendly risk residue profiles is very important as well. We do have some products out here that are approved for use in dairy cattle that have very short withholding times because they are safe for human use in humans after shorter withholding times. We need to follow the label directions. So if you have the manufacturer's label and it's an over-the-counter product, or if you're using a prescription product, you can follow the manufacturer label. But again, prescription products would be prescribed by a veterinarian. If the veterinarian has recommend that use the product in an extra label fashion, the veterinarian will put an additional label on that product that will extend the withholding time for meat and milk. So follow those label directions. Don't try to shortcut those. We need to be very vigilant about training our employees to how we want things managed on our operation. Many of the errors or the violations that I have been involved with have been because of lack of communication between management and their employees on what the expectations are for holding animals out until their withholding times are completed. We need to make sure we keep good records. And when we think about it, daily is much more beneficial than coming in once a week and plopping all the records down and plugging them in once a week. So daily records, at least written records in the barn, and then maybe once a week you could enter them into the computer. But the main thing is keeping good records, because the records are going to be your salvation. If you have a violation, records are going to be what gets you out of it. And let me just use an example here real quickly, because we had a producer in northern Illinois that had a violation in young beef, young calves, and it was a residue violation. What happened was the cattle buyer that picks up their bull calves once a week or twice a week, his truck broke down, and so he couldn't pick up calves for a little while till the truck was fixed. So they end up keeping their bull calves around for 2-3 weeks until the guy fixed his truck. As soon as he got his truck fixed, he came and picked up a group of bull calves off this dairy operation, and he had a couple of them that were really growing well and looked great, so he sent them on into a veal plant to get slaughtered. Well, unbeknownst to the cattle buyer, the cattle hauler, one of the calves had gotten a navel infection. And so the gal that works the calf barn at this dairy operation, she read her treatment protocol, said calf with a navel infection gets 3 to 5 cc's of penicillin once a day for 5 days. And so she treated a calf according to what a navel infection gets treated, written protocol. She had documented that the calf got treated. The only problem was she didn't document when that calf could go to slaughter. And so that calf was shipped from the farm before that slaughter withholding was met, and that farm then had an antibiotic violation, and they're on the residue violator list. The FDA did come in and investigate that incident. They were there for a very short period of time because all they had to do was open up the books. The books said, here's our written protocol for navel infection. Here's the calf that got treated. We got the treatment records that show we treated that calf. We just made a mistake and shipped the calf before it was slaughter withholding time. So they've implemented different procedures then to make sure that any animal that's treated, calf or cow, has some kind of identification on it until a slaughter with time is over. So again, the records are what saved this operation from a more extensive investigation, and so records will be your salvation there. Lastly, we want to make sure that we verify, again, that meat and milk withholding time for every animal before it goes into the food supply. So one other little story I like to tell here is that had another producer, this is on the cow side, that had a pen of cull cows that were ready to go to and the cattle buyer came and picked up the cattle. And there was actually 9 cows in the pen, only 8 were supposed to go. All 9 cows were on the truck, and one of the cows had a residue, and it was not intended that the cow was to be shipped, but she ended up getting on that truck as well. And so now the owner of this operation, he creates a list on the day that the cattle buyer is coming to pick up cull cows, and everybody has to cross-check that list before the animals leave the operation. So there's a double-check system to make sure that no cow gets on that trailer that wasn't supposed to. Finally, we need to watch out for what we'll call exceptions. And again, this is the 1%. When a cow is really sick or a calf is really sick through dehydration, kidney and livers don't function properly, and even if you used a drug according to label, it may have some residues left in the calf because, again, there's the organ failure that occurs during some really severe disease. But again, these are the exceptions, not the rules, so don't use that as an excuse. But if I did have a really sick animal, it may be worthwhile to keep her on the farm 30 to 60 days past her withholding time just to make sure everything's cleared up before she could go into slaughter. So in summary, we know that residue monitoring are going to become much more stringent and much wider in scope. So any producers that's making their own extra label decisions, such as extra label use of penicillin, they may be in for an unexpected outcome, which may mean that they might have an FDA investigation coming their way, and that might lead to further sanctions. We also have to keep in mind that protocols and prescriptions are a legal document between the veterinarian and the herd owner. So those directions must be followed. Meat and milk withdrawal times must be adhered to. And that if there's any changes to a drug residue protocol, that has to be done with the authorization of the veterinarian. Without that, the producer is, again, taking the liability in their own hands. So let's make sure we take the high road and remember that, yes, we are here as a dairy industry to produce milk, but every dairy cow has 2 careers. It first starts with milk, and then it finishes with beef. And so currently the society trusts dairy producers to make wholesome milk and beef, and we don't want to violate that trust. Thank you for visiting with us on residue violations.